Do you need to get Medicare if you are working? And what happens if you already have Medicare A and B and you're still working? In this video, I'll go over what you can do with Medicare A and B if you're working and you have it. And I'll go over whether or not you need A and B if you're working. There are actually two different kinds of classifications if you're on the Medicare program or age 65 and you're still at work. So first, let's tackle that one. So if you're at work, age 65, and you're in a company that's considered a large group, meaning there are more than, I believe, 20 individuals insured and working in that group, then you don't have to sign up for Part B. Your insurance at work is the primary insurance, which means that it pays first, and the insurance that's on top of that, which would be the Medicare Part A, pays second. If, though, you are in a group that has less than 20 employees, Medicare has to be or is meant to be your primary. So what that means is Medicare pays first, and then if you have group coverage, that group coverage pays second. So for most people who are in small groups that have, I'm not going to call it bad plans, but have plans that cost a lot of money when you have to use it, sometimes it's better just to waive the group coverage, the employer coverage, the workplace coverage, and buy into Medicare A and B and get a Medicare Advantage plan or a Medicare Supplement plan and a Part D drug plan, whichever one makes your life easier. And that is for people who are with an employer after the age of 65, and that employer is a small group which has less than 20 employees. You have to get Medicare Part A and B. Medicare Part A and B is your primary. If you do not have Medicare A and B, even if you have group coverage, the group coverage will not work because you're supposed to have A and B. And if it does pay, it only pays 20% for Part B services, and it only pays for whatever the $1,600 Part A deductible is in relation to whatever services you get at the hospital. So you could be looking at ridiculous bills because you would be the primary in that case. You as the individual would be the primary, and the employer would be the secondary insurance. So that is not a good position to be in, especially if you don't even know that you're in that position. I've heard horror stories of people having to pay the entire bill because they did not get Part A and B when they were supposed to, and they were still covered under a group. All right, I'm going to bypass all the political things and bureaucracy and all the crazy stuff because there's nothing I can do about that. But what we can do is I can tell you what happens if you want to be safe, like I talked to somebody today, and you actually have A and B and you're in a large group. Okay, so how does that work then? Well, if you're in a large group and you have A and B, then your group, the main one, pays first, and Medicare will pick up whatever is left up to the amount that Medicare, you as a Medicare beneficiary, would have to pay. So it's not that you don't pay anything, it's that if you have, let's call it a $100 doctor visit, it's $100 raw. That is what the medical provider bills your insurance company. And your insurance company says, oh, you have a $40 copay. Okay. But under the Medicare program, it's 20%. This is provided you've met your annual Part B deductible. $20 visit, 20%, right, of 100. So therefore, you need to just pay $20. Medicare says, all right, to make you pay just $20, we, Medicare, has to pay $20 to the physician to make it so that you, the member, only pays $20. So what does that look like? The primary insurance company, your work insurance, pays $60 toward that doctor. Medicare Part B pays $20, and you pay $20. So that's how it works when you have Medicare as a secondary. Now, if you have Medicare A and B and you decide, hey, you know what? There's this great Medicare Advantage plan I found, and since it's my secondary insurance, I can join, and I'll get all the dental and stuff, benefits, and it's still my secondary. So how did it work in this case? Well, in this case, provided all the network stuff was aligned, this same doctor visit, and you had a copay on your Medicare Advantage plan of $0. So how did it work? I'm sure you guys are following the logic here. So again, the insurance company for your employer has a $40 copay. That insurance company pays your doctor $60 again. Now that doctor is in network with the PPO plan or HMO plan that you are a part of for Part C, and your copay for them is $0. So your copay for that doctor visit now would be $0, because that is how much the Medicare Advantage plan, or your amount, your copay for that service should be based on the Medicare plan that you're in, because that's the secondary coverage. So it pretty much takes you up to whatever that is. Now, if you have a different copay for the Part C plan, then it's not going to be $0. It's going to be whatever that copay is, $10, $25, or if it's a specialist, potentially, upwards of $50. But that's how it all stacks up and rolls down. You got to make sure network is okay though, because under Medicare A and B there is no network, so pretty much whatever you bill for, that's kind of what you would get. Financially, it's not as strong as some of the Medicare Advantage programs, copays and co-insurances, but with the Medicare Advantage plans you have to worry about network adherence, and also sometimes prior authorization. Your insurance company at work might approve a service, and then their Medicare Advantage plan might say, no, we don't approve that service, and then you won't get any help. But that's how that kind of works, the pros and cons. Now, what are the pros and cons of enrolling versus not enrolling? Now, I said that in the beginning about the network versus no network, right? Part C Advantage plans, they're private plans, they have networks, PPO, HMO, as well as service restrictions, sometimes prior authorizations. Part A and B, Part A and B, on the other hand, they don't have any of those networks or restrictions, but they don't. You're still paying for quite a bit, right? 20%. So maybe not as strong as a Medicare Advantage plan in that financial sense, but in the flexibility sense, yes. Continuing, right? What else? Well, Part C has additional benefits, things like dental, vision, hearing, gym membership, healthy food cards, etc. And all of those things are most likely on your group plan going to come at a cost. Dental usually on group plans come at a cost, and dental on group plans is typically, at least as far as I've seen currently in this market where I live in Texas, the dental plans that work are not as good as the dental plans on the Medicare Advantage side. So you might be able to get a better dental plan versus the one at work. So you can cancel the one at work if you are given that opportunity, right? You can cancel the one at work, or you can use them both. So a lot of times, dental plans, they work in silos, so you can use both of them, or you can use one or the other. So if you have a lot of services one year, you can use up a few cleanings on one, and then when it comes to the big stuff, use the big plan to pay for more of the expensive services like crowns and root canals, right? You have two plans to draw on for, maximum benefit allowance per year. Not a bad thing. Vision as well. You could have two plans there, so you could use vision to get contacts and the other plan to get glasses. Very, very useful if you know how to kind of play with the different things. Now, is it wise? Should you do it? Well, it really depends. A lot of people, once they sign up for A and B, to unsign up for it after you've already been on it for a couple months, couple years even, it is a headache. You have to make a meeting with Social Security and let them know why you are canceling Part B. Initially, when you get Part B, if you're on Social Security or you're collecting, they'll automatically send it to you at age 65. The reason they do this is they think you're retired. But what you can do is you can actually send back the Part B card and tell them you don't need Part B, and they'll cancel it for you. Usually, it's best to call them to make sure that they do, and that way they don't bill you. But that's how that works. But is it worth it? Is buying Part B when you're still working a good idea? All right, well, first, it depends on how good or bad your health insurance is at work. Health insurance at work is 75-25. What that means is the insurance company, well, the employer, has to cover 75%-ish of your medical expenditures, and you have to pay for 25%. Medicare, on the other hand, is an 80-20 for outpatient services and a deductible of, let's call it $1,600 in 2023 for hospitalization. So that's your cost sharing, 80-20 and $1,600. The Part B premium right now is $164. So if you're paying more than $164 a month for your medical insurance at work, Part B might be an option for you based on that. Now, there are also certain scenarios where group insurance, the work insurance, is going to be better, especially if you're on a lot of expensive medications that you're getting for relatively cheap. And a good way to test for that is by plugging in your information into like Medicare.gov and seeing how much your medication would cost if you bought a Part D plan. That's pretty much how much it would cost if you were enrolled in a Part C plan or a Medicare Advantage plan as well. So that's good to kind of give you a feel for what your true out-of-pocket would be if you were to leave the group side or the work insurance and just transition fully onto the Medicare program. Another thing to consider, and this is going to be way more relevant in 2025 when Part D has a hard cap on of $2,000, then you can make a lot more educated decisions because your plan at work and the plan for Medicare would look almost identical, especially with the maximum out-of-pockets and then the maximum out-of-pocket with the drug, because they'll be kind of together. So that's how I would decide whether or not to buy Part B and join and stay in Part B for, versus work, or if I had work insurance and wanted to keep it and I had bought Part B and was just like, should I join a Medicare Advantage plan? I would say really mull over the specifics and how the plan is going to operate, because a lot of people are just paying for the Part B for nothing. They're not getting any benefit at all. While some people could be getting, a ton of benefit. I mean, if you're still at work, you could get into a plan that has a give back, and that plan could be just giving you back money, because you're on Part B, and you're just like, yeah, I'm on Part B, but I'm still working, so I'll just get the give back, $100 a month or whatever. And I have a plan. It's not very good, but I'm not using it because my work insurance is paying for everything. It really does depend on your circumstance, what's available in your area, and how good your work insurance is. All right, so I hope that kind of cleared up a little bit about work insurance, when you need to enroll, what happens if you have Part A and B and you already have group insurance, and what happens if you sign up for Part C plan, if you have group insurance. All right, we will see you in the next video. Do good things, have a great day, and I'll see you in the next one.